I think kind of pulls together everything that I've been talking about with these other webinars and the type of patients that we're getting in the office. Now, the old days, we used to get the average patient. I used to tell the patients here, my average patient was a 70-year-old diabetic female. And you know what? Right now, my average patient is about 42 years old. And they have a lot of different causes of neuropathy. That's why we created the Neuropathy Academy, to get you in there and see these things and get these straightened up. So you're going to have low levels of vitamin D are associated with neuropathy, lymphoma, and Sjögren syndrome. Now, I know that I've talked to you about lymphoma. We had the video about 2 weeks ago. Sjögren syndrome, these are the autoimmune neuropathies that are going to walk in your office one after the other. These people that are 40, 50 years old, they have neuropathy associated with autoimmune disease. So lymphoma, non-Hodgkin's lymphoma, Sjögren's, lupus. Just had a lady yesterday with lupus. I mean, it just destroys her life. And we can supplement them. It's part of your care. So Sjögren syndrome, but you can look it up because we've done about 4 of these webinars on it, is a chronic autoimmune disease primarily involving the exocrine glands. The clinical picture of Sjögren syndrome ranges from just gland problems to kidneys, lungs, liver, skin, muscles, and the nervous system. We just know that the skin and the nervous system is affected. You have neuropathy from no other reason that you have Sjögren's or this autoimmune disease. Okay, the morbidity of Sjögren syndrome is mainly determined by exoglandular disease and increases prevalence of lymphoma. Environmental hormonal factors such as vitamin D play a role in the pathogenesis of this process in the disease expression. They want to look at the vitamin D levels of these people. So they looked at 176 Sjögren patients with matched with healthy controls. The mean vitamin D levels between Sjögren's and patients was about the same. Peripheral neuropathy was diagnosed in 23% of these and was associated with lower vitamin D levels. Okay, so these are both clinically low, even a normal patient. And lymphoma was diagnosed in these patients also, okay? So nothing else showed up, just low vitamin D in the neuropathy patients and the lymphoma patients. So neuropathy is low levels of vitamin D correlate with presence of neuropathy and lymphoma in these Sjögren's patients, and they want to benefit them. Okay, and so this is a great one. This is the other paper. They say, look at this, done in Israel. Okay, so vitamin deficiency in fibromyalgia patients. So as I say over and over again, fibromyalgia is a garbage diagnosis. Most of the time, these patients have undiagnosed autoimmune problems, which gives them neuropathy. I mean, this is the same thing we talked about last month. And look at the vitamin D deficiency in these patients, all right? So what did they find? 30 females were included in the study. The mean age was 35, okay, 34 and a half. The mean vitamin D level was 5, okay? So we want deficiency is under 20, okay? Vitamin D insufficiency, okay, so there's deficiency and then insufficiency. And okay was 30, but we want it more like 80. Okay, so this vitamin D deficiency is often seen in patients with fibromyalgia because it's not fibromyalgia. It's a neurologic disorder. It's a neuropathy caused by autoimmune disease. Okay, so this is another great one to show that the sun and the vitamin D and stuff like that. Here we have the desert. So there is, look at this here. This is an idea. Sika syndrome, dry eye and mouth, includes both the Canadian and international case studies for CFS-ME. And then 1/3 of CSF-ME patients met the diagnostic criteria for Sjögren syndrome. Okay, so here's an interesting thing. Look at these syndromes here, all right? MECFS. I mean, they're going to come at us with all sorts of diseases, but this is they have their alliance, a worldwide alliance, and MECFS, chronic fatigue syndrome, and there's this myalgic encephalomyelitis and chronic fatigue syndrome. I mean, they just put names on everything. Okay, and so what? Okay, so here's a little bit novel aspects of Sjögren syndrome. Just to show you a little bit about this is a systemic autoimmune disease characterized by complex pathogenesis involving immune cell activation and autoantibody production. The immune response is directed to the exocrine glands. Sika syndrome, dry eye, dry mouth, dry vaginal fluids, but major organs can also be involved. The etiology of the disease is unknown, but infection could play a pivotal role. They have lots of Epstein-Barr virus, and this cytomegalovirus, which is everywhere, can trigger this autoimmune effect, or the gluten, as Chris and many of our members know. So recent findings seem to show low vitamin D levels in Sjögren syndrome. Okay? So novel aspects of Sjögren syndrome. This is a nice, beautiful Italian one, and I just wanted to touch on just a couple things. Okay, look at this. This is what I'm talking about. Sjögren syndrome is a chronic autoimmune inflammatory disease. The syndrome can either be alone, primary, or underlying connective tissue diseases, rheumatoid arthritis, lupus, and secondary. But also scleroderma and everything will be in there. Here's the HLA. Remember HLA B27? That's what we learned in chiropractic college. But there's a bunch of different things that happen. So various antibodies, including the Rho and the La, anti-La and anti-Rho. So that's how you can actually check these patients, by doing the blood work on them. It's real simple. Okay. Typically, Sjögren syndrome presents with dry eye, okay, dry mouth, and dry vaginal fluid. So usually presents over a period of years. They feel gritty or sand in their eyes. The dryness in mouth has difficulty in swallowing dry foods without liquid. They can't eat crackers. They frequently small sips of water also at night. They lose their antimicrobial properties of saliva, and they have worse cavities. Okay, they get candidus, parotid swelling, which is, that's actually, lupus. It's often difficult, but you can find out from the patients if they have these conjunctive eyes. And these patients are sick. I got a patient right now that has this thing, and she doesn't fit any of it. But, this is a little breakdown of it. If it's aqueous deficiency, you're looking at the dry eye. So the low vitamin D levels are associated with neuropathy in these patients. So that's the paper that we just went through. Given the association between hypovitaminosis and severe complications, it can be proposed that vitamin D supplementation should be given to every patient with Sjögren syndrome, or every patient with neuropathy, or every patient with these things. Okay, so you can look that paper up if you like. So we have any questions or comments? Huh? Anybody? Anybody want to raise their hand and talk before we race to the finish here? Anyone? 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 Let's see. I'll get the rest of those at the end. So let's talk about this one, which